Pneumonia has become the leading cause of death in Mongolia, according to recent reports from the Ministry of Health. The number of people visiting hospitals due to respiratory issues has quadrupled over the past decade, with 10% of people per 10,000 visiting hospitals for respiratory issues 10 years ago, compared to 40% of people per 10,000 currently. The deterioration of people's health is attributed to a weakened immune system and antibiotic resistance. Upon testing, it was discovered that the bacteria causing pneumonia had become resistant to all antibiotics. Experts stress the importance of following doctors' instructions for the prescribed period of time to reduce the risk of complications.
The reason behind the deterioration of people's health is the immune status and antibiotic resistance. After testing and seeing what kind of bacteria are causing it, it has become resistant to all antibiotics. The risk of complications will be reduced by following the doctor's instruction for the prescribed period of time.
In developed countries, vaccines have been used to reduce mortality from pneumonia, and scientists in Mongolia believe administering flu vaccines with pneumonia vaccines could help reduce complications from the disease. Pneumococcus is a major cause of pneumonia, meningitis, and acute respiratory infections in young children. Researchers suggest that implementing a vaccine among adults, especially among them from at-risk groups, would decrease the number of infections and mortality rates.
Pneumococcus causes pneumonia, meningitis, and acute respiratory infections in young children. All these can reduce the number of infections. Very good results have been observed, such as a decrease in the incidence of pneumonia, a decrease in the mortality rate, and a decrease in the incidence of mortality due to meningitis. Therefore, since we have basic research, it is advisable to administer the vaccine among adults, especially among at-risk groups.
Individuals at high risk of dying from pneumonia include children under 2 years of age, people over 65 years of age, pregnant women with serious illnesses, and mining workers. In recent years, cases of severe pneumonia among mining workers have increased. The cost of non-hospital pneumonia treatment averages $55,000 internationally. The introduction of a vaccine against this disease could reduce the incidence of pneumonia by 50% among young children, according to estimates. The Ministry of Health is urging Mongolians to take measures to prevent the spread of pneumonia, including getting vaccinated and following healthy lifestyle habits.